This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Sarabjit Kaur. With me is Subhadra Ramachandran. The headlines. Centres ask states and union territories to ensure vehicles carrying essential and non-essential items are not detained by police. Over 6,000 Jan Aushadhi Kendras across the country working on war footing to ensure availability of affordable medicines during lockdown. Indian Council of Medical Research says 40 vaccines under development for COVID-19. UGC constitutes committee to promote online learning. And World Bank praises Arogya Setu app launched by India to curb COVID-19. Government has said that guidelines on exemptions during lockdown were not being followed properly in some parts of the country. It said vehicles carrying essential and non-essential items were being detained by police that could lead to potential shortage of commodities. In a communication to Chief Secretaries of all states and union territories, Home Secretary Ajay Bhalla said that in some parts of the country, the guidelines and clarifications on exemptions given to people and services are not being implemented in letter and spirit during the ongoing lockdown. He said trucks carrying essential and non-essential goods are being detained and workers needed for operation of manufacturing units of essential goods and other exempted categories are not getting passes for their movement during lockdown. Home Secretary said interstate and intrastate movement of all trucks and other goods vehicles with one driver and one additional person is allowed as long as the driver is carrying a valid driver's license. The ministry said warehouses and cold storage should be allowed to freely function with allowance for to and fro movement of trucks and without regard to the nature of the goods, whether essential or otherwise. Warehouses of companies should also be allowed to operate. The number of COVID-19 cases in the country has climbed to 8,447, while the death toll rose to 273. Health Ministry data said the number of active COVID-19 cases stood at 7,409. As many as 764 people have been cured or discharged and one had migrated. Maharashtra has the highest number of 1,761 cases, followed by Delhi with 1,069 and Tamil Nadu 969. Highest number of 127 people have lost lives in Maharashtra. Madhya Pradesh has reported 36 deaths, followed by Gujarat 22 and Delhi 19. Briefing media in New Delhi yesterday, Joint Secretary in the Health Ministry Love Agarwal said the government is extra prepared in case of exponential rise in COVID-19 cases. He said government is focusing on strengthening infrastructure and surveillance as part of strategy to manage COVID-19 positive cases. The Joint Secretary said, based on the discussions at the level of Health Minister and Home Minister, work is on urgent basis to expand capacity for COVID-19 testing in government and private medical colleges across the country. Listing out several measures, Mr. Agarwal also said the centre is well prepared to deal with the situation and 1,05,000 beds are ready in the dedicated 601 COVID hospitals.
डेडिकेटेड कोविड हॉस्पिटल्स जिनके द्वारा इन्फेक्शन ना फैले और पेशेंट्स को प्रॉपर ट्रीटमेंट मिल सके, उसको भी स्टेट के साथ मिलकर सेंट्रल गवर्नमेंट इंस्टीट्यूशंस के साथ मिलकर बनाया जा रहा है। और अब तक की अगर संख्या देखें तो 586 डेडिकेटेड हॉस्पिटल स्टेट ने हमें रिपोर्ट किए हैं, गवर्नमेंट ऑफ इंडिया और स्टेट गवर्नमेंट ने मिलाकर, जिसके द्वारा करीब 1 लाख प्लस आइसोलेशन बेड्स और करीब 11,500 आईसीयू बेड्स भी उन्होंने प्रिपेयर किए हैं। और यह फिगर दिन प्रतिदिन हम बढ़ाते जा रहे हैं डिपेंडिंग ऑन सिचुएशन।
Joint Secretary in the Home Ministry Punya Salilya Srivastav said the situation regarding essential commodities is under control. She also said the state governments are making door-to-door delivery of essential items in hotspot areas so that people do not have to step out.
गृह मंत्रालय ने आज स्टेट्स और यूटीज को फिर से स्पष्टीकरण दिया है कि इंटर स्टेट एवं इंट्रा स्टेट कार्गो की आवाजाही पर कोई भी रोक नहीं है, चाहे आवश्यक वस्तु या उसके अलावा कोई भी वस्तु ट्रांसपोर्ट हो रहा हो।
Dr. Manoj Murhekar of Indian Council of Medical Research said over 1.86 lakh samples have been tested so far, out of which 7,953 have been found positive for COVID-19. On a question regarding vaccine for COVID-19, he said over 40 vaccines are under development, but none have reached the next stage, and as of now, there is no vaccine.
40 plus candidate vaccines which are under development, but अब तक कोई भी वैक्सीन नेक्स्ट स्टेज में पहुंचा नहीं है। इंडिया की तरफ से भी उस वैक्सीन डेवलपमेंट के प्रयास हो रहे हैं, but as of now we don't have any candidate available.
Over 214 Lifeline Udan flights have been operated by Civil Aviation Ministry to transport essential medical cargo to remote parts of the country to support India's war against COVID-19. 128 of these flights have been operated by Air India and Alliance Air. Cargo transported till date is around 373 tons. The special focus has been on the Northeast region, island territories and the hill states. Air India and IAF collaborated primarily for J&K, Ladakh, Northeast and other island regions. Our correspondent reports, special permission has been taken to store cargo in the passenger seating area and overhead cabins with due precautions. Union Minister of Consumer Affairs, Food and Public Distribution, Ram Vilas Paswan said the government will deal strictly black marketeers and hoarders. In an exclusive interview to DD News, Mr. Paswan said that more than 30 lakh metric tons of food grains have been sent to states and union territories. He also said that during the lockdown announced to contain COVID-19, instructions have also been given to states to ensure food supply to all, including people without ration cards.
देश की जनता को ये आश्वस्त करना चाहते हैं कि हमारे पास में खाद्यान्न की कमी नहीं है और जितना जरूरत है उससे हमारे पास में 2 गुना अधिक हमारे पास में खाद्यान्न है। हमको प्रति महीना चाहिए 60 लाख टन का और रिपोर्ट के मुताबिक 11 के रिपोर्ट के मुताबिक FCI के पास में करीब 300 लाख टन जो है 299.45 लाख मेट्रिक टन चावल और 235.39 लाख टन गेहूं है।
Railways has continued feeding the infrastructure sector and ramps up the supply chain during the COVID-19 lockdown. Railway Ministry said from 1st April to 11th April this year, Railways has transported more than 1.9 lakh wagons of coal and over 13,000 wagons of petroleum products. An emergency freight control center is working in the ministry to monitor the uninterrupted movement of materials, fueling the power, transport and infrastructure sectors and other essential commodities by rail. Railways, along with Ministry of Home Affairs, is keeping in touch with state governments to sort out any operational issue.
National Informatics Centre, NIC, facilitated a record number of digital payments in the country during the last fortnight. The highest number of around 22 million transactions assisted by the robust system of Public Financial Management System, PFMS, was recorded on the 30th of last month, by which transfer of relief fund was made to around 2 crore beneficiaries. More from a correspondent.
Team of just 18 strong-headed technocrats in the National Informatics Centre who, like any other COVID warrior, are toiling day in and out to ensure that the government's financial packages reach directly to the beneficiaries, and that too without any delay. In the last week of the previous financial year, around 72 million transactions took place. More than 32 crore people have already received more than 28,000 crore rupees under the direct benefit transfer of the Pradhan Mantri Garib Kalyan Yojana. While speaking to AIR News, DDG NIC Mr. Nagesh Shastri said,
sometime the lockdown happened, NIC's team has been supporting from their residences by accessing the system through the virtual private network. But this system in isolation with NIC people is not working. It is working in tandem with the external systems, that is major systems such as Manrega, PM Kisan, and of course officers of Controller General of Accounts who have been making the payments.
Apart from Centre's financial packages, NIC is also handling the transactions of various state governments as well. Anand Chaturvedi, AIR News, Delhi.
Union Health Minister Dr. Harshvardhan has exhorted scientists to develop COVID-19 mitigation solutions, keeping a fixed time frame in mind, saying these are times of war and it should not be treated as a routine research project. He held a review meeting with the Director General of Council for Scientific and Industrial Research, Shekhar Mande, and all the 38 CSIR lab directors. During the meeting, Mr. Mande said a core strategy group, CSG, has been set up and 5 verticals have been identified under which coronavirus-related activities are being carried out. About 2 crore masks have been produced by around 78,000 self-help group members of 27 state rural livelihood missions. Rural Development Ministry has said that around 5,000 personal protective equipment, PPE kits, have been manufactured by these groups in various states including Madhya Pradesh, Himachal Pradesh, Punjab and Karnataka. More from our correspondent.
As the masks are the first line of defense against COVID-19, the members of the self-help groups immediately took up the task of production of masks. The masks have been supplied to the health department, local self-government, local administration, frontline workers, police officials, and also sold in open market. It has also been distributed free to the rural households in many states. Self-help group members have now also started making personal protective equipment like aprons, gowns, and face shields. More than 900 groups in 9 states have produced 1,15,000 liters of sanitizers. Some members of the group have also been selling liquid soap to guarantee safe hand hygiene. The members of the group have emerged as community warriors by contributing in every possible way to contain the spread of COVID-19. With Dipen, Anupam Mishra, AIR News, Delhi.
In the wake of COVID-19 pandemic, Khadi and Village Industries Commission (KVIC) has successfully developed a double-layered khadi mask and has procured orders for supplying it in large quantities. Talking to AIR News, KVIC Chairman V.K. Saxena said the Commission is specifically using double-twisted khadi fabric for manufacturing of these masks as it helps retain 70% of the moisture content inside while providing an easy passage for the air to pass through. Mr. Saxena informed that the KVIC has recently bagged an order to supply 7.5 lakh pieces of khadi masks to Jammu and Kashmir government alone. This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Centre asks states and union territories to ensure vehicles carrying essential and non-essential items are not detained by police. Over 6,000 Jan Aushadhi Kendras across the country working on war footing to ensure availability of affordable medicines during lockdown. Indian Council of Medical Research says 40 vaccines under development for COVID-19. UGC constitutes committee to promote an online learning, and World Bank praises Arogya Setu app launched by India to curb COVID-19. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Government is working to ensure that affordable medicines are available at 6,300 Pradhan Mantri Jan Aushadhi Kendras across the country. Minister of State for Chemicals and Fertilizers, Mansukh Mandavia, has said the warehouses of Jan Aushadhi centres are working day and night on war footing to deal with the current situation due to COVID-19. During the lockdown, pharmacists of Kendras are delivering quality generic medicines at affordable prices to the common citizens. The mobile application Jan Aushadhi Sugam is also available for common public to locate their nearest Jan Aushadhi Kendra and availability of medicines with its price. Minister for Human Resource Development Ramesh Pokhriyal Nishank has launched a web portal Yukti, Young India Combating COVID with Knowledge, Technology and Innovation in New Delhi. The portal and dashboard will monitor and record the efforts and initiatives of Ministry of HRD. It intends to cover different dimensions of COVID-19 challenges in a holistic and comprehensive way. Speaking on the occasion, Mr. Nishank said, in the wake of COVID-19 threat, the primary aim is to keep the academic community healthy both physically and mentally and to enable a continuous high-quality learning environment. The portal is an effort of HRD Ministry to achieve this goal in these difficult times.
मानव संसाधन विकास मंत्रालय से तमाम जुड़ी छोटी बड़ी संस्थाएं हैं, वो क्या क्या काम कर रही हैं और वो क्या क्या अभी तक उन्होंने अनुसंधान किया है, वो सभी इकट्ठा एक स्थान पर होगा। कोरोना वायरस के इस महामारी से जूझ रही है, इस संकट से उबरने के लिए ये तमाम संस्थान क्या शोध कर रहे हैं, क्या अनुसंधान इन्होंने अभी तक किया है, वो सभी जो उनके प्रयास हैं वो प्रयास एक स्थान पर प्राप्त होंगे।
Amid the nationwide lockdown, University Grants Commission (UGC) has constituted a committee to promote online learning. UGC Chairman D.P. Singh said it has also formed a committee to look after the examinations and academic calendar in the present circumstances. He said under the lockdown situation, it is essential to think about how the prescribed syllabus can be completed and what type of examination system would be followed. He said on the basis of the committee's recommendations, which will be submitted next week, UGC will issue guidelines for universities in consultation with Union HRD Ministry. Mr. Singh said to maintain social distancing, online learning and e-education is the only way out. UGC chairman said online education is need of the hour for students, teachers and education system as a whole.
In Jammu and Kashmir, Midday Meal Schemes Department of J&K has contributed significantly by addressing the nutritional requirements of the poor students enrolled in the government schools in the wake of COVID-19. The department provides 100 grams of food grains to primary level students every day, whereas 150 grams of food grains are provided to the students enrolled in the upper primary. Our Srinagar correspondent has filed this story.
Mission Director Midday Meal Scheme J&K Dr. Arun Manahas has said that amidst the lockdown imposed due to COVID-19 pandemic, the department in league with Food Civil Supplies and Consumer Affairs distributed dry ration under Midday Meal Scheme to around 8 lakh students in the Union Territory of Jammu and Kashmir. According to him, 4,42,768 students were given dry ration in Jammu Division, whereas 3,59,718 students were given dry ration in Kashmir Division. Besides, account details of the students have also been obtained for transferring the cooking component amount of midday meal scheme to these students through direct benefit transfer mode. It is pertinent to mention here that midday meal scheme is aimed to improve the nutritional status of the children from classes 1st to 8th, besides encouraging them to attend the schools on regular basis. This is Sunil Koul for AR News from Srinagar.
The high-risk zones of COVID-19 in the national capital will be declared as orange zones. The containment zones have already been declared as red zones in the city. Briefing reporters in New Delhi, Chief Minister Arvind Kejriwal said a massive sanitation drive will be undertaken in these zones from today. He also expressed concern over increasing number of COVID-19 cases in Delhi, saying his government is taking all necessary steps to contain the outbreak. Meanwhile, 10 new areas were added to the list of such containment zones, taking the total tally to 43 in the national capital. Uttar Pradesh government is working on the Jaan Bhi Jahan Bhi formula of union government and will follow all instructions of centre regarding lockdown. Meanwhile, ministers and senior officers of state government will resume their duties from 15th April with due importance to social distancing. More from our correspondent. In Gujarat, local self-governments are also at the forefront in the fight against COVID-19. The Gram Panchayats of India's first smart village, Punsari, is using technology at its best in tackling the global pandemic. A report from our correspondent.
Pusri is a village in Sabarkantha district of Gujarat which is known for its digitized education, internet infrastructure and cleanliness. Talking to AIR, Sarpanch Himanshu Patel said,
लॉकडाउन के चलते हुए शहरों में भी इस प्रकार से पालन हो रहा है, उस प्रकार से ग्रामीण क्षेत्र में भी लॉकडाउन का उसी प्रकार से पालन हो, इसके लिए गुजरात के छोटे से गांव में बहुत अलग अलग प्रकार से प्रयास किए हैं। लोग स्वयं सिस्टम में भी रहते हैं और गांव में लगे सीसीटीवी कैमरे के मॉनिटरिंग की वजह से उनके ऊपर भी नजर रखी जा रही है। जब गांव में किसी का डेथ होता है तो हमने डिजिटल उन लोगों की श्रद्धांजलि सभा करके गांव में बाहर के लोग न आए, उस प्रकार से उस वे से हमने डिजिटल शांति सभा का भी आयोजन किया है। गांव में ग्रामीण क्षेत्र के लोगों को उसकी अवेयरनेस आए, उनकी जागृति बढ़े, इसीलिए एक नुक्कड़ नाटक की तरह 3 कलाकारों ट्रैक्टर ट्रेलर में बैठ के हर गली नुक्कड़ में जाके लोगों को इस बारे में जागरूक भी करे।
Such initiatives at Panchayat level really strengthen our fight against COVID-19. With Yogesh Satwara from Sabarkantha, this is Aparna Khut, AR News, Ahmedabad.
Meanwhile, Gujarat has registered 23 new cases on Sunday, taking the total number of confirmed cases of COVID-19 to 516. Briefing media persons at Gandhinagar last evening, Principal Health Secretary Dr. Jayanti Ravi said that out of 23 new cases, 16 recorded in Ahmedabad, 6 in Vadodara, while 1 new case is recorded in Anand district. A report.
Gujarat government is fighting COVID-19 in the state with multi-pronged strategy. State police with the help of RAF and other paramilitary forces implementing the lockdown very effectively, while municipal corporations in Ahmedabad and Vadodara are focusing on hotspot areas of the city to contain the infections. Mask wearing has been made compulsory in Ahmedabad municipal area from today. Health department is busy with various district administrations to complete the work of 100-bed COVID-19 hospitals in each district, while civil supply department is ensuring free distribution of ration to all needy families, including above poverty line card holders. State government has already relaxed the functioning of Agricultural Produce Market Committee (APMCs) and fishing activities in the sea for fishermen amidst strict lockdown. Yogesh Pandya, Air News, Ahmedabad.
In Madhya Pradesh, the total number of infected patients in the state has increased to 564 after new patients were reported in Indore and Bhopal yesterday. Corona infection has spread in 22 of the total 52 districts of the state. However, the good news is that so far, 15 people have fully recovered.
In Indore, 311 people are infected with the coronavirus. The number of patients in Bhopal has increased to 134. New patients have also reported in Dhar and Khargone district. Meanwhile, the state government has introduced e-pass facility in case of death and other medical emergencies during lockdown. At the same time, to protect the uniforms of armed forces personnel from corona infection, the 7th Corps of Special Armed Forces located in Bhopal have made special boxes of modern technology. These boxes prepared by IIT Ropar are based on the ultraviolet sanitization technique. Through these boxes, uniform, belt, cap, badges of soldiers, especially posted on duty, as well as other armed forces personnel are being protected from infection. Sanjeev Sharma, AIR News, Bhopal.
In Maharashtra, the number of COVID-19 patients is approaching 2,000 mark as the total number stands at 1,982 with 221 new cases yesterday. 22 deaths were reported yesterday. With this, 149 people have died so far in the state. A report.
Strict actions have been taken at various places in Maharashtra against those who are not following the health advisory issued by the administration. 92 people were fined for not wearing masks in Aurangabad and a total of 46,000 rupees were collected from them. Many markets have been kept closed as the people are not following social distancing and making the places overcrowded. But the market can be opened in the next 2 days as the APMC traders, transporters and committee members held a meeting in the presence of Additional Chief Secretary Sanjeev Jaiswal, Divisional Commissioner of Konkan Shivaji Dawn and Police Commissioner of Navi Mumbai Sanjay Kumar. The vendors will hold a meeting today to chalk out the plan to reopen the market within 2 days. The government is now focusing on home delivery system at various places in the state and have issued passes to the vendors. Shailesh Patil, AIR News, Mumbai.
In Tamil Nadu, 106 new COVID-19 cases were reported yesterday, taking the total to 1,075. State Health Secretary Dr. Bila Rajesh told reporters that 8 doctors have also been infected with the disease. 50 people have been discharged so far, with 6 patients discharged yesterday. Meanwhile, the death toll due to the disease has gone up to 11, with a patient from Chennai losing the battle yesterday. More from our correspondent.
In Tamil Nadu, all the people being identified with the symptoms for the SARS-CoV-2 infection during the ongoing home screening are being tested for the COVID-19 disease. The screening forms part of the containment plan that is being implemented in areas where the residences of known COVID-19 patients are located. The screening helps identifying any hidden patients with the highly infectious disease. The Health Secretary has said 49 such people with the symptoms were tested yesterday, whose results revealed 2 COVID-19 cases. On a positive note, the number of people with home quarantine has dropped to nearly 44,000 people, as more than 58,000 have successfully completed the quarantine period with no symptoms. Jai Singh, AIR News, Chennai.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Randeep Guleria, Director AIIMS, suggested that at this time there is nothing better than staying at home to curb the spread of COVID-19 infection.
या घर के अंदर एक एरिया बना लें जहां पे आप वॉक कर सकते हो। दूसरा इंपॉर्टेंट इशू इज मेंटल हेल्थ। इसमें ये बहुत जरूरी है कि हम लोगों से सोशलाइज करें, जो परिवार के लोग हैं उनके साथ इकट्ठे बैठ के बात करें, कुछ इंडोर गेम्स खेल सकते हो, कार्ड्स हैं तो कार्ड्स खेल सकते हो, इकट्ठे बैठ के कोई टीवी पे मूवी देख सकते हो। इस टाइप की कई एक्टिविटीज कर सकते हो जिससे आप सोशलाइज भी कर लें। ज्यादा हुआ तो अपने दोस्तों के साथ फोन पे बात कर सकते हो, चैट कर सकते हो, जिससे आप अपने आप को बिजी भी रखो, मेंटली स्ट्रांग रखो।
Talking to AIR News, Dr. Naresh Gupta of Loknayak Jayaprakash Narayan Hospital said there is no proven medicine to prevent coronavirus infection.
As far as we know, there are no medicines of proven value to prevent COVID-19. But there are some medicines which tend to be given on an empirical basis to the healthcare providers because they expose to a whole lot of onslaught of the coronavirus through the COVID-19 patients that they treat. As for the vitamin C or lemon, one can take it. It has been taken for preventing cold for hundreds of years. But there is no scientific evidence that vitamin C causes any prevention of common cold or of coronavirus also.
To listen to other experts, tune in to our next bulletin. Dr. Madhur Yadav, Director and Professor in Medicine at Lady Hardinge Medical College, New Delhi, said wearing of mask is an important tool to contain the spread of COVID-19. Talking to AIR during a special program on COVID-19, Dr. Yadav said,
मास्क हर एक आदमी यदि नहीं ले सकता है तो कम से कम आप अपना अंगूछा गमछा अपने नाक के पास बांध दीजिए। आपने भी महसूस किया होगा जब बहुत गर्मी पड़ती है तो लोग अक्सर अंगूछा लेके निकलते हैं, अपने चेहरे को ढक लेते हैं, वो भी एक तरह का मास्क है। दूसरी बात यह है कि बाजार में बहुत से मास्क मिल रहे हैं लेकिन उतने टेक्निकल मास्क N95 हर एक के लिए जरूरत नहीं है। हाँ, आप कपड़े से बना मास्क ले सकते हैं, आप ट्रिपल लेयर वाला मास्क ले सकते हैं। और रही मास्क की शेल्फ लाइफ की बात करनी है तो मैं तो कहूंगा कि अगर आप रुमाल भी लपेटते हैं, आप घर पे जाइए, धो के सुखा दीजिए या थोड़ी देर धूप में डाल दीजिए, कुछ ना हो तो थोड़ा सा उस पर सैनिटाइजर लगा दीजिए, मास्क को दोबारा तैयार होता पहनने के लिए।
World Bank has praised the Arogya Setu app launched by India to curb the COVID-19 pandemic. Citing example of the app, a World Bank report said innovative solutions can greatly help educate and track contagion across the populations at large. South Economic Focus report of the World Bank said that digital technology can also be used to monitor the spread of COVID-19. It said India recently launched Arogya Setu app that uses location data from persons' smartphones to tell users if they have been near someone who tested positive for COVID-19.
India has shipped the first consignment of 5,022 metric tons of wheat to Afghanistan to ensure food security during difficult times of COVID-19 pandemic. Indian Embassy in Afghanistan has announced that 251 containers carrying the first consignment of 5,022 metric tons of wheat out of the total gift of 75,000 metric tons from India to Afghanistan set sail from Kandla port to Chabahar port yesterday. Top oil-producing countries have agreed to cut output in order to boost plummeting oil prices due to the coronavirus crisis and a Russia-Saudi price war. Kuwait Oil Minister Khaled Al-Fadel announced the agreement to cut production by nearly 10 million barrels per day by OPEC Plus members starting on May 1.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. V.K. Paul, member Niti Aayog and chairperson Empowered Group for Medical Emergency Management Plan to tackle COVID-19, will participate in the discussion.
And now an overview of today's newspapers covering COVID-19 stories. In a bid to strike a balance between extension of lockdown and refueling economic engines, the Hindustan Times headline reads, Ministry's pitch plan to balance livelihood. There is likelihood that there may be exemptions for agriculture, factories and transport of goods. Government may start economic activity in green zones is the lead in the Business Standard. Recognizing India Inc.'s biggest challenge in the months ahead, redeeming bonds and meeting other loan obligations, the Financial Express on its front page states, it's a rough ride ahead for India Incorporated. Ensuring compliance of the SC directions as regards welfare of migrant labourers housed at relief camp, states UTs told to ensure welfare of migrant workers, informs the Tribune.
And now, before we end the special news program on COVID-19, the headlines once again. Centre asks states and union territories to ensure vehicles carrying essential and non-essential items are not detained by police. Over 6,000 Jan Aushadhi Kendras across country working on war footing to ensure availability of affordable medicines during lockdown. Indian Council of Medical Research says 40 vaccines under development for COVID-19. UGC constitutes committee to promote online learning, and World Bank praises Arogya Setu app launched by India to curb COVID-19. And with that, we end the special news program on COVID-19.